Hello again. Today we are going to be looking at what makes it hard to regulate emotions. This applies to people who are both emotionally sensitive and those who are quite calm, reserved, and seemingly in control. The world around us calls for a response more often than it doesn't. To be completely rational and not have an emotional response will be just as extreme as overly responding and not having any understanding of how to regulate. Beyond acknowledging what makes it hard to regulate emotions, we are going to cover a model of emotions, their characteristics, their components, and primary and secondary emotions. The whole point of having skills is to be good at things that can otherwise be difficult. Since regulating emotions is very hard, we want to acknowledge that biology, lack of skills, reinforcing consequences, moodiness, mental overload or overwhelm, and emotional myths can make regulating emotions difficult. When it comes to biology, some people are born more emotionally sensitive than others, and they may remain that way into their childhood and then onwards to adulthood. The intensity of emotions also differs biologically. If you are highly emotionally sensitive and highly intense, it can get in the way of learning emotion regulation strategies. It can also get in the way of using strategies when they've been learned. Lack of skill is not knowing how to change or regulate your emotions or emotion-related actions. If you don't know how to regulate, you might see this as a reason not to try and regulate and to allow for their intensity. Not having skills is very different from not having motivation. Learning emotion regulation starts in infancy. There is an emotional exchange between mother or other caretaker and baby. That is the start of the training. Child rearing, in many ways, is a task to teach children how to regulate their emotions. Some parents are very good at this. Some try hard but don't have the skills themselves. And some don't have the time or the desire to teach at all. Some parents can't regulate their own emotions and find it extremely difficult to teach their children. Because of biological sensitivity, some children have much more difficulty learning to regulate their emotions than others. If one has been taught, has a good example, and has had practice, and does not practice emotional regulation, they are not motivated to do so. Skills and their use are frequently context dependent. You can have one set of skills in one situation, but not in another, or in one mood, but not in another, or one frame of mind, but not in another. The importance of skill learning, building, and mastering is that you can automatically apply a skill no matter what context you're coming from. Emotions have functions. When the function of a certain emotion is reinforced in a particular situation, it can be really difficult to change that emotion. If people only listen and help you when you get very sad or depressed and cry a lot, it will be very hard for you to stop being sad. Sometimes emotions do you good, even when they're painful or intense or get you in trouble. When this is the case, it can be very hard to change your emotions. You may not even realize that you can't change your emotion because of the benefits you get by behaving and feeling the way you're behaving and feeling. When this happens, your emotions are being reinforced, even if you don't want them to be. Emotions are reinforced when they do various things for you. Reinforcing consequences may communicate important messages or cause people to do things for you. They may motivate your own behaviors so that you do things that are important to you. They may validate your beliefs and what is going on in the situation, or they may make you feel better than you would feel without them. Can you see if any of these things are happening to reinforce an emotion? It could be difficult to regulate these emotions. If you wanted to feel something different than what you are feeling and getting this reinforcement for, that might be difficult too. It takes a lot of effort and energy to regulate emotions. It also takes willingness, which we will cover in distress tolerance skills. Moodiness and lack of energy can interfere with your willingness to do the work emotion regulation takes. You may be capable, but it may interfere with your current mood. This would be another example of having skills versus being motivated. Not being in the mood would be a lack of motivation. Sometimes your emotions can be so extreme that you simply cannot get into wise mind in order to figure out what to do. This can be called high arousal or overwhelm. When you are highly aroused, worry, thoughts, and rumination can keep the emotion firing like a computer program that is automatically started when you get highly emotional. Worries get started and track your brain into thinking that there's actually an answer to your worries. Usually there is no answer, so the worries go round and round and round. Often, worries function as a way to escape your emotion. Escaping your emotions, however, keeps you from attending to them effectively. You may have the skills. Ruminating interferes with using them. Extreme anger or other intense emotions can feel very out of control. Reasonable mind does not have a chance to surface and moderate the influence of emotional mind when you are in emotional overload or when you're overwhelmed or highly aroused. Faulty beliefs about emotions, the value of expressing yourself, and the ease of recognizing and controlling emotions can cause much trouble. When you are trying to learn emotional regulation, some myths invalidate emotions and your emotional experiences. An example would be believing that a negative emotion is selfish. What is invalidating is that these myths in no way resonate with your experience of your emotions. Other myths undervalue emotions. They ignore the effectiveness of emotions and their expression and assert that if you have them, you should not change them. These are both extreme stances to take. Both sets of beliefs can interfere with emotional regulation. Emotions are complex, full system responses. Changing any part of the system can change the entire response. Knowing the part of an emotion can guide you to change the emotion. There are several characteristics of emotions. They are complex and generally consist of several parts or different reactions happening at the same time. They are automatic, involuntary, and respond to internal and external events. Emotions can be changed directly. No, they can't. They cannot be changed directly. We can change the events that caused emotional experiences, but we cannot change the emotional experiences directly. We can't tell ourselves to feel differently or to feel a particular emotion and then feel it. We cannot use willpower to stop an emotional experience, even when we desperately want to. Emotions are sudden and they rise and fall like the tides. The intensity of a particular emotion may build up slowly over time, but they ordinarily occur suddenly. Emotions come in waves and typically last from seconds to only minutes. Emotions are self-perpetuating, however. Once an emotion starts, it keeps restarting. Emotions love themselves. This is because emotions sensitize you to events associated with the emotion. When you are afraid of the dark, every sound you hear seems to be something you should be afraid of. When you fall in love, the person you fall in love with seems to be absolutely amazing, positive, and perfect. Emotions have components. They are interrelated and influence each other. Although an emotion can be thought of as a complete and transactional systemic response to external or internal events, they can also be helpful to examine each component separately. Because there are several components, it's important to realize that if you change one component, the entire system has an opportunity to change. Basic emotions are universal. These are the emotions that we mentioned in the last lesson: anger, disgust, fear, guilt, joy, jealousy, envy, sadness, shame, and love, and two more, though this isn't totally agreed upon: interest and surprise. People are born with the ability and biological readiness to feel these 10 to 12 emotions, which are considered basic emotions. Others are learned and are usually a combination of the basic emotions. There are components to an emotion. These are prompting events, vulnerability factors, biological changes, experiences, expressions, actions, emotion, names, and after effect. First, there's prompting events. These are the events or situations that occurred right before the emotion starts. They are the cues that set the emotion off at the particular moment instead of at some other moment. Prompting events can be external or they can be internal. If they're external, they are events in the environment, including things that people do. If they are internal, they are your own thoughts, behaviors, and physical reactions that prompt your emotions. One emotion can prompt another secondary emotion. Events can prompt emotions automatically. You may feel fear when looking down from a high place, or joy when you watch a sunrise. When prompting events change, emotions can change. You can change a prompting event proactively in order to change your emotional response. You can avoid it, or you can take an action that changes them through problem solving. The next component of emotions is attention or awareness. If you are not aware that there are prompting events happening, you will not have an emotion. The event has to grab at least a part of your attention to have an effect. An example would be someone saying something mean to you while you're walking down the street, but you're wearing your noise-canceling headphones, so you don't hear it. There's no emotion without awareness. Even when an event is internal, it won't prompt an emotion if you are not aware of it on some level. The attention grabber can be very rapid, but it has to be there. When attention is distracted, emotions can change. The third component of emotions is interpretation of events, acting as the prompting event. Often what really sets off our emotions is our interpretation of the prompting event, not the event itself. Interpretations are thoughts, beliefs, or assumptions about an event or judgment of an event. You're walking down the street and you see a close friend of yours. You shout their name and wave, and they are wearing those noise-canceling headphones and don't hear or see you. You interpret that as them ignoring you or having a problem with you, or that they don't want to acknowledge your presence. Interpretations can contribute to complex emotions. Interpretation, as well as beliefs and assumptions or myths on which they are based, may become part of a very complex emotion. Despair is sadness combined with the belief that things are terrible and will never get better. Many interpretations are based on learned beliefs. If you didn't know a car could hit and kill you, you may not be afraid to walk out into traffic. When interpretations change, emotions can change as well. You can change emotions by checking the facts and then changing your interpretation or beliefs or assumptions accordingly to the facts. The fourth component of emotions is vulnerability factors. These are conditions or events that make an individual very sensitive to prompting events, more likely to make emotional interpretations, and more biologically reactive to specific events. These events could happen right before the prompting event, or they could be in the distant past. Events in the near past can make us vulnerable. If you haven't had enough sleep, didn't eat lunch, don't feel well, or you're drinking or using drugs, you're likely to be more vulnerable to emotions than at other times. If you're rejected by one person and then rejected by another, you may have a stronger reaction to the second rejection. Events from the distant past can make us vulnerable to the present. This is particularly true if you have not processed or resolved the prior events. This is common when people realize they are reacting to people in their current life the way they used to react to their parents, let's say. When a person has post-traumatic stress disorder, they often respond to even small events that are associated with the traumatic event as if the trauma is happening again. When vulnerability factors change, emotions can change. If you reduce current vulnerability factors like abstaining from drugs and alcohol, getting appropriate sleep, meeting your nutritional needs, your emotions will likely change. You can also increase resiliency factors in other ways, such as using strategies to desensitize yourself to cues linked to past events. The fifth component of emotions is biological changes. When an emotion fires, several complex biological changes occur almost simultaneously. Emotions involve neurochemical changes in the brain. The limbic system, in particular, appears to be very important in regulating emotions. The brain changes that happen when you feel an emotion then have an effect on the rest of the body. There are emotional brain circuits. Different circuits appear to be associated with different broad groups of emotion. Examples include the rage-anger system, the fear-anxiety system, the lust-sexuality system, the care-nurturing system, and the play-joy system. Different parts of the brain and different neurochemicals are associated with firing of emotions and the regulation of emotions. Some people have difficulty regulating all emotional circuits, and some only have difficulty regulating one or maybe a few. Differences in right and left brain activation can influence vulnerability to certain emotional states. Higher activation of the left regions of the brain are related to predisposition for positive emotional states. Higher activation of the right regions of the brain are related to predisposition for negative emotional states. Some research suggests that people have trouble regulating their emotions because of their brain chemistry. Emotions involve nervous system changes as well. The nerves that are peripheral to the brain and spinal cord send signals to the muscles to contract or relax and also control autonomic activities like heart rate, breathing, digestion, and reflexes. All of these responses are also part of emotionally responding. There are two nervous systems controlling autonomic processes that act in opposite direction from each other: an activating system and a deactivating or quieting system. When we are under stress, the activating system kicks in. This is the sympathetic nervous system. It increases heart rate and blood pressure, cools the skin, makes you sweat, increases your rate of breathing, and it activates the release of glucose to give you energy. It prepares you to act now. The other system, called the parasympathetic nervous system, counteracts the action by slowing down the body. When we are relaxed, this quieting aspect of the system takes over. When biological processes change, emotions can change too. This could be done through medications, neural feedback, behavioral skills that are aimed at invoking the parasympathetic nervous system, yoga, and many other approaches and techniques. Psychoactive drugs work to control emotions by changing chemistry. This can have a powerful effect on emotions. However, once the brain knows the drugs are in there, it often changes its chemistry to compensate, and the drugs stop working. Dysfunctional behaviors can also regulate emotions through biology. Using drugs, drinking excessively, or engaging in self-harm can regulate emotions by regulating biology. In these cases, however, the behaviors take a great toll on you in other ways. The next component of emotions is experiences. Emotions are almost always associated with the experience of feeling, sensation, and with urges to do something. Both our feelings and our urges prompt us to act in some way. Sensations are also called feelings. When we have emotions, we are actually sensing our body and our brain changes. This is what's meant by an emotional experience. Because the sensations are a big part of emotions, we sometimes refer to emotions as feelings. Sadness involves sensations of low energy, heaviness, and emptiness, as an example. You cannot change your experience of sensations directly. From an evolutionary point of view, the feelings and experiences emotion evoke are critical to survival. The experience of sensations can be changed indirectly, however. For example, we can focus our attention on something else, or we can change our biology to block the sensation. An important function of emotions is to prompt behavior. Fighting, anger, flight, and fear, many of the nervous system changes are designed to activate the body to be ready for action. As the body gets ready for action, very strong urges to act can arise. The seventh component of emotions is expressions. Emotions help you communicate. If that's one of their functions, an emotion has to be expressed. Facial expressions communicate emotions, and for basic emotions, they're actually hardwired. In all cultures, the same facial expressions are linked to the same basic emotions. Many actions that express emotions are also hardwired. A change in facial muscles when emotions are activated is universal. People are extremely sensitive to facial expressions from early childhood onward. When you're an infant, emotional expressions are especially important as social signals because you can't verbally communicate. Changes in facial muscles may actually play a very important role in causing emotions. You have more nerves in your face than anywhere else in your body. The importance of facial expression and communication with others is likely very important to survival. Body language communicates emotions. Even when you can't see someone's face, a body can communicate emotions. Posture can be relaxed or tense, drooping, shoulders back. Hands can be clenched or open and relaxed. Each different posture sends a message to others that how and what you are feeling is X. People can learn to inhibit emotional expressions or express them differently for complex emotions that are learned. The expressions are also learned. Some facial expressions and behaviors may express different emotions depending on one's overall culture or regional culture and one's family, school, and individual differences. Words communicate emotions. Telling other people how you feel about them, yourself, and events, or how you feel in general can be very powerful. It can improve others' understanding of you and also elicit reactions in others. When facial and body expressions change, emotions can change. The connection among your body, face, and emotions is so tight that you can change your emotions simply by changing your facial expression. This is called the facial feedback hypothesis. You can also change your emotions by changing your posture, how you hold your hands, and the tightness of your muscles. An example would be, if you are very afraid or anxious, you can feel calmer by relaxing your muscles. Changing emotional expressions is different from suppressing emotions. When you suppress an emotion, you are working hard to restrain, stifle, or hold back a natural expression. Suppressing emotions can actually lead to more extreme emotions. When you change an emotional expression, you are replacing one expression with another. You are actively altering your muscles to modify your expression. This is generally hard to do if your face and body are very tense, as they usually are when you're trying to suppress an emotion. In other words, we're not changing what you are expressing, but how you are expressing it. The relationship among facial expressions, body language, and each individual's actual emotional experiences is not an exact correspondence. This is particularly so when what you say does not match your tone or your facial expression and or your posture. When this happens, almost everyone will pay attention to the non-verbal communication and ignore the words. This is a problem for those whose words are more accurate than their non-verbal expressions. The eighth component of emotions is actions. One of the primary functions of emotions is to prepare the body for action. Thus, an action itself can be thought as part of an entire emotional response. Emotions in general can be thought of as a rapid response system. Emotions evolved in order to promote actions necessary for survival. When actions change, emotions can change. You can change your emotions by acting opposite to the emotions, action, urge. We'll cover that later in the module. The 9th component of emotions is emotion names. Naming emotions is universal and helpful. In order to name an emotion, you need to be aware of the emotion. When you communicate to others how you feel, it is important to be able to identify what emotion you are actually feeling so that your communication will be accurate. People who can give an emotion a name experience less negative emotion. Naming emotion is a learned skill. It's easier to name simple emotions than complex ones. Through awareness and meaning, emotions can be changed. We will work on this later in the module 2. The last component of emotions is after effects. Intense emotions can powerfully affect memory, thoughts, the ability to think, physical functioning, and behavior after the fact. Emotions love themselves, remember? One of the most important after effects of emotions is that we become hypervigilant to cues and events that could set off the same emotion, and attention is narrowed away from information that is incompatible with the emotion. Emotions organize us in such a way as to keep refiring. If you feel you've been stuck in an emotion for a long time, you have been focusing on cues that reinforce it and focusing away from things that oppose it. When you are afraid, you often become hypersensitive to any threat to your safety. When you are in love, you ordinarily see all the positives in that person you love and do not see the negative. Monitoring after effects of intense emotions can help you change subsequent emotions. When you know that intense emotions narrow attention and increase sensitivity to cues from the same emotion, you can remind yourself to check the facts, knowing that you may be seeing things through the lens of the emotions you are trying to change rather than the lens a present reality can be helpful for. Just a short note on primary and secondary emotions. Primary emotions are your immediate first reactions. They are the spontaneous emotional reactions to events outside of yourself. Secondary emotions are usually reactions to your primary emotions. Sometimes secondary emotions follow primary emotions so quickly that you do not even notice that the primary emotion happened. Sometimes you've spent so much time suppressing your primary emotions that you automatically jump over the primary emotion and never even experience it. Here, you developed a habitual secondary emotion response. Anger is often a secondary emotion to fear. In fact, for some people, anger is a secondary emotion to many primary emotions. Fear can also be a secondary emotion. For example, when a person is fearful of anger, secondary emotions can make identifying the primary emotion difficult. If you cannot identify the primary emotion, you will have trouble changing it. Problem solving in regard to primary emotions can be difficult. This will come up again and again working with emotions. Now you know why it can be hard to regulate your emotions. You know the characteristics of your emotions and the components of emotions. We just touched on primary and secondary emotions. That's a lot. It's kind of interesting though, isn't it? That is it for today's lesson.